Today, we're very lucky to be joined by Zaf Naqui, who is the head of the BSSH Communications Committee. Zaf has previously been on the council of the society and is going to give us some insight into the Communication Committee today. Zaf, thanks so much for joining us. I'm going to start off with a question. Why does such a small organization such as the BSSH with under 500 members need a communications committee?
I think it's a good question, but it's precisely because we're a small society and what we're about in terms of our aims and objectives. We want to promote hand surgery, safe and high quality hand surgery for our patients. And for that to occur, we need to be able to get the message out that there are such things as hand surgeons, both for patients as well as our fellow medical professionals. And that is precisely why we need to be able to speak out and speak up through the communications channel that the BSSH has developed.
Well, thank you very much, Zaf. That makes good sense. And do you have any advice for our members of should they be approached by the media or by other groups that come to them and say, what about this operation that you've done or operations that we'd like you to consider? It was in the Daily Mail last week. What should our members do when they ask for advice by outside organizations?
It's a good question, and we're increasingly having more interaction with the media. In fact, the BSSH Communications Committee has just developed a guide for our members, and that should be coming out to our members in the next few days. So I would say to the membership to look out for that guide, and hopefully it is useful. But the basic principles are to do an interview on your own terms. Don't be hurried or rushed into it. Think carefully in advance in terms of what you want to say, and don't be pressured into saying what perhaps the agency or the media would like you to say, and to stick to things that you feel are facts and truthful. But the guide will be coming out very shortly.
Zaf, that segues nicely into my next question. Will the guide be on our website? And further, regarding our website, do you think it's good enough, and how can we use it to help our patients, to give them information about conditions and operations that they might be having?
The website has undergone significant development. Members will know this, active members will know this. It's very well developed for our membership and reflects the huge amount of work that the BSSH is doing in different workflows. The other thing that we've noticed is that actually the public is accessing the website, and because of this, we are now developing the website further with far more patient-facing section, because we see that that the public is coming to the website to understand about conditions and treatment. So this will be a big...
When can we expect more information for our patients when they ask us this?
So the Communications Committee is working through the website and with various other committees, such as the Hand Trauma Committee, the Education Committee, to come up with both patient videos and patient information. So this will be coming in the next few months.
Super, thank you very much. Just a couple of final questions, and I'll let you get back to your clinical work. You know, a lot of people don't like social media or didn't grow up with social media. How important is it really for your clinical practice, for your private practice, for your day-to-day life?
Social media does require commitment and consistency, which is a problem once you've actually navigated it and learned how to use it. There are various rules and regulations using social media, and you can be caught out. And this is one of the reasons why people want to avoid it. However, as previously mentioned, hand surgery is very niche, and it's within our profession. Recognition of the concept of a hand surgeon is really important for us to maintain standards and quality, and for patients to go to the right people. So we need to have that voice, and social media is the current forum, the space where you can communicate with your patients and the public directly. And so it is very useful to have a social media presence, and many of us have that now.
Thank you, Zaf. So just a final question. As a practicing surgeon, if you do have any issues and you really want to get hold of the Communication Committee urgently or about a matter, how'd you get hold of them?
So you can get hold of us in many ways, through the website. You can email the Secretariat of the BSSH, or you can send us a direct message on social media through the big 4 platforms that we're on. And of course, if you'd like to get involved with the Communications Committee, again, you can communicate to us in any of those methods.
Well, thanks, Zaf. Really grateful for your time today. A lot to know and a lot to learn, and it looks like communications are fairly bright for the BSSH in the future. I wish you a good day, and we'll catch up soon in person. All the best.
Thanks, Max. Lovely speaking to you.
Thanks, Zaf. Bye-bye.